Well, good morning, everyone. Good morning. I'm so happy to be here with all of you this morning. Chairwoman Hendrickson, you're just amazing. What can I say? Just incredible, incredible. So, I really wanted to take this minute this morning to reflect with all of you back on COVID and our public health response. It is so important to really spend time reflecting on this because our future generations need the truth. They need perspective as we move forward. And we've learned so much, and we need that knowledge tremendously to move forward. So we have lost in this county alone over 1,700 people in Gwinnett County to COVID or complications related to COVID. So thank you to the coalition in Gwinnett Cares for thinking of the ribbons, because that's what the ribbons are for, is to remember their lives. And, please, with me, continue to pray for their families and loved ones and remember their lives. So this is going to be part of my wardrobe from here on out. I'd also like to recognize the significant contribution of our healthcare professionals. So if you are a first responder, if you're a healthcare professional or belong to one, or if you're a volunteer, would you please stand to be recognized? And I know many of you should have stood up, but you didn't, but in any event. But we deeply, deeply thank you for your sacrifice, for your commitment to our community, your faithful service, and your loyalty in serving others. I also want to recognize Sherwin Levinson. Is he here? He's traveling. Oh my goodness. Sherwin Levinson is the CEO of our Medical Reserve Corps, and I just really, when you see him, if you would just personally thank him, countless hours and tremendous assistance that they gave us and continue to give us through their work with all of their volunteers. And I also want to personally thank every speaker before me and to follow me this morning, as well as Renee Lewis-Bird from the Gwinnett Coalition and Paige Havens. Where's Paige? There she is in the back. Oh, yes. From Gwinnett Cares. All of these relationships have been the glue within which we have really meshed together to keep Gwinnett County vibrant and resilient and our community just throughout this pandemic. Every single one of you have played and continue to play a vital role. So let me take a minute just to kind of review where we've been. So would you put the first slide up? Okay, good. So 2020, the year of panic, right? The novel, never before seen, new deadly virus that hit us hard and fast throughout the world. Fear, uncertainty, anxiety, worry gripped our nation. Test supplies were limited and few. People were panicked for themselves and their loved ones. The demands for personal protective equipment were higher than the supplies. Hospitals struggled as to how to treat those who were sick and infected, and worried they wouldn't have enough ventilators and would have to choose who gets a ventilator because those were in short supply also. Doctors and nurses and first responders were literally heroes, risking their lives to save other people. And CDC guidance changed every single day, right? Every single day. And we were so critical over that, but really no one really knew what to do. And what on earth is public health, right? Public health has been behind the scenes forever, and no one really knew much about public health or what we do. And what about those populations that were affected the most, with COVID at this point? But Gwinnett County partners banded together to help each other. Our local officials, our EMAs, the Community Foundation, Gwinnett Coalition, our county, our cities, Good Samaritan Health Center, our schools, nonprofits, and more of these organizations grew every single day during the pandemic. We gathered more and more, as the chairwoman said. Together, We work to make as big of an impact on our community as possible and ease our community's struggles for food and housing and isolation, quarantine, work, internet supplies, and so much more. Zoom meetings took off. Telemedicine went on steroids, right? Community partners collaborated for hours every single day, sharing daily information and updates that were critical for planning and changing the environment. So next slide. So now it's been a year, okay? Our brilliant healthcare system figures out how to treat this virus, remdesivir, monoclonal antibodies, alternative ways to treat people and ventilate people who need oxygen without putting them on that dreaded ventilator. Record time development of a vaccine, unprecedented science and applied technology, finally some help. But we don't have enough vaccine, right? Who gets it first? And we can't get it to people fast enough. So our amazing Chairwoman Hendrickson, who, by the way, had not long before this been elected, steps forward, opens up a huge vaccination site within Gwinnett County, turns it into the most successful, longest standing, most effective vaccine site in the state. Sherwin Levinson, absolutely. Sherwin Levinson steps up and sets up his medical reserve for thousands of volunteer hours to help us. But our nation is divided, right? Mistrust, misinformation, disinformation. How do we know who to trust, right? And the anti-vaccine movement. Now it's a race. We have vaccine versus variant, right? And it's a triathlon. So healthcare begs people at this point to get vaccinated, to save themselves, not infect their families, to spare our healthcare resources, and we focus on equity. We have to get this to populations affected the most. Access is critical, and our community partners in Gwinnett County continue to work tirelessly to increase access to these vulnerable populations. So we start giving people money and incentives to get vaccinated, and desperately do everything possible to take this vaccine into communities. Our healthcare professionals are now leaving the profession in groves. They're tired, they're worn out. But once again, our community partners continue to be relentless and engaged, and again, remain the strongest support structure for our community. Okay, next slide. We missed one? Go back one. There we go. I was like, we're not there yet. All right, so 2022, 2 years now into this pandemic. In January, Omicron is the worst variant yet, okay, infecting many, many more, and our healthcare resources are now dwindling and overwhelmed in January. But thank goodness, after January, Omicron mutates, and now the virus is less deadly. And although it's still more transmissible, it's less deadly, right? And although COVID is still with us, it seems now that the vaccine is winning now, right? More of our community is vaccinated. Lots of people have had COVID and have some level of natural immunity. And we now have Paxlovid. We have other monoclonal antibody treatments to help reduce hospitalizations and deaths. So our healthcare resources get a chance to recover. And once again, our county steps up with innovative uses, as she said, innovative uses of funding for significant infrastructure development that will fill gaps, far-reaching and much long-lasting impact as COVID becomes part of our normal. So next slide. So where are we going, right? COVID is with us and will always be with us, like influenza. And we will most likely have an annual vaccine, whether it's mixed or not mixed with influenza. And now everyone knows what public health does, right? Yeah. Public health touches every single person that lives, works, or visits our county. Public health prevents disease, outbreaks, chronic disease, overdoses, Public health protects our community. Food poisoning, biohazards, smoking, communicable diseases. Public health prepares our community for emergencies, sheltering, even our neighbors, helping our neighbors shelter, disasters, mass events, pandemics. So our work has to be prioritized. We have to remove barriers to health equity, health access. We also have to get a handle on substance misuse, STDs, HIV, mental health, maternal and infant mortality. Public health is necessary and more visible now than it ever has been before. So our goal in public health is to be proactive in all of these areas. And we need you, our community partners, so that we can all work together to transform the health of our community. And I challenge all of you to think outside of the box as to how we can all do this together. You know, immunity against COVID looks different now than it did 2 years ago. And COVID is now our personal responsibility. It's an individual responsibility now. Our community needs to own our vaccination rate. So I challenge all of you as community partners to be influencers, to be encouragers, to help educate all that we serve about COVID and about all of our health issues. We have health equity navigators, as Chairwoman Henderson brought up. In public health, we have them in Gwinnett Coalition. We have them at the county level to make all this happen, but we need you as community partners to do this. We are so blessed, I've said this a million times, we are so blessed to be in a community where collaboration of partners is valued and prioritized. We are all part of that Gwinnett standard, you know, that she talks about. And I just look forward to continuing our work together. So thank you so much.